symptoms, and prevention strategies. Syphilis is an infectious and sexually transmitted disease caused by the bacterium Treponema pallidum. It is one of the oldest known sexually transmitted diseases, and its effects can be devastating if left untreated. Syphilis can be passed from person to person through contact with infected skin, bodily fluids, and even from mother to child during childbirth. Fortunately, with proper knowledge of the causes, symptoms, and prevention strategies, it can be prevented from spreading and can be treated effectively. Knowing the signs of infection, such as a painless sore, rashes, and swollen lymph nodes, is the first step in diagnosing and treating syphilis. Additionally, preventing the spread of the disease through safe sex practices, such as the use of condoms, can help protect those at risk. By understanding the causes, symptoms, and prevention strategies of syphilis, we can work together to prevent and treat this serious and potentially life-threatening disease. What is syphilis? Syphilis is a potentially serious disease caused by the bacterium Treponema pallidum. There are 3 stages of syphilis: primary, secondary, and latent. During the primary stage, usually beginning at a young age, there are sores or open wounds on the genital area, anus, or mouth. In the secondary stage, the sores become red and sized up to a few centimeters in diameter. During the latent stage, the sores heal, but may become ulcers in the mouth or anus. In order to be diagnosed with syphilis, a person must have 2 of the following 3 stages: primary, secondary, or latent. Syphilis can be diagnosed through a blood test that detects the bacteria in the blood. If left untreated, syphilis can cause serious damage to the body, including damage to the heart, blood vessels, brain, eyes, bone, and lungs. Untreated syphilis can lead to serious and sometimes permanent health issues, including cardiovascular disease, paralysis, blindness, stroke, mental disorders, and impaired fertility. Since syphilis can be serious and lead to serious health complications, it is important to get it diagnosed and treated as soon as possible. Causes of syphilis. There are 2 types of syphilis. The first type is called primary syphilis, and is caused by the bacteria Treponema pallidum. The second type is called secondary syphilis, and this is a result of the bacterium spreading from the primary stage of syphilis to other areas of the body. During the primary stage, a person may experience one of the following: anal sex, genital sex, or oral sex with an infected partner. During the secondary stage, syphilis may move to other areas of the body, such as the skin, bones, blood vessels, eyes, or brain. In addition, the person's sphincter muscles, which control the flow of urine and feces, may be affected, leading to an increased risk of transmitting syphilis to others during sexual intercourse. Symptoms of syphilis. During the initial stage of syphilis, primary stage, a person may experience a painless sore at the site of the wound. The sores may be single, grouped, or multiple. During the secondary stage of syphilis, when the bacteria have spread to other areas of the body, sores may appear in the mouth, anus, or genital area. During the latent stage of syphilis, when the body has healed, the sores may not appear until several weeks or months later. The sores may be fluctuant, meaning they may disappear and reappear, or they may be itchy or painful. During the primary stage of syphilis, the person may have a swollen lymph node in the groin or armpit area. During the secondary stage, the swollen nodes become larger and may be painful or painful to touch. If syphilis infects the brain, the affected area may be swollen or painful, or there may be a severe rash. Syphilis can cause damage to the heart, blood vessels, eyes, and brain, but it is important to note that the damage is usually permanent, meaning it cannot be reversed. Diagnosing syphilis. During the early stages of syphilis, a person may have only 1 or 2 symptoms. If a person has these symptoms and a painless sore at the site of the wound, it is important to get treated. If the person does not have a painless sore, he or she may have only flu-like symptoms, which include mild sore throat, swollen lymph nodes, fever, fatigue, and body aches. Unfortunately, many symptoms of syphilis are not noticeable. If a person has any of the following symptoms, he or she should see a doctor: painless sore, primary stage; swollen lymph nodes, secondary stage; swollen joints; latent stage; hormone imbalance, including irregular periods and infertility; secondary stage; severe pain in the brain; latent stage. Treatment of syphilis. There is no cure for syphilis, and it can be very serious if left untreated. When a person has syphilis, he or she should be treated immediately. Doctors may prescribe antibiotics, which are taken orally to treat bacterial infections. The person may also need to be treated for any associated syphilis-related damage, such as damaged heart, blood vessels, or brain. In order to prevent the spread of syphilis, the infected person should abstain from sex until the sores are gone. If a person has syphilis and does not receive treatment, it may advance to the secondary stage and damage other parts of the body. Treatment for syphilis is extremely important because it can prevent damage to other parts of the body and improve the health of affected sex partners. Complications of syphilis. If left untreated, syphilis can cause damage to the heart, blood vessels, brain, eyes, bone, and lungs. If syphilis damages the heart, the person may experience a racing or irregular heartbeat and may have palpitations, or a racing heart. If syphilis damages the brain, the person may have a headache, forgetfulness, loss of control over bodily functions, or a stiff or weak body. If syphilis damages the eye, the person may experience a headache, dull vision, or eye pain. If syphilis damages bone, the person may experience pain, swelling, or a limp. If syphilis damages the skin, the person may experience a rash, or itchiness. If left untreated, syphilis can damage the sphincter muscles of the anus and bladder. This can lead to increased risk of transmitting syphilis during sex. Prevention of syphilis. There are several ways to prevent syphilis. The first is to get tested for sexually transmitted diseases, such as syphilis, regularly. By testing regularly, a person can identify any sexually transmitted diseases, such as syphilis, early and get treated. In addition, a person should abstain from sex until all sores are gone and all damage caused by syphilis has been repaired. By abstaining from sex, a person can lower the risk of contracting syphilis and protect his or her partner. Syphilis can be prevented through safer sex practices, such as using a condom during vaginal sex and latex gloves for anal sex. Additionally, a person should practice safer sex by abstaining from sex with partners who have STDs, such as syphilis. By following these safe sex practices, a person can lower the risk of contracting syphilis and protecting his or her partner from contracting STDs.